What did the doctor see in my surgery that scared him to death? I went in for a routine gallbladder removal and woke up to the recovery room nurse backing away from my bed with her hand over her mouth. She dropped her clipboard and practically ran out of the room when I asked if everything went okay. Nobody would tell me what happened during the surgery, but I could hear urgent whispering in the hallway. The surgeon never came to check on me after the procedure, which was strange because he'd promised to update me as soon as I woke up. When I asked for him, the nurses kept saying he was busy with other patients, but I could see him through the door, just standing at the nurses' station staring at nothing. He looked like he'd seen something that had broken his understanding of the world. They discharged me 2 hours early without the normal post-op instructions. The nurse left my discharge papers on the bedside table and backed out of the room without ever getting close to me. When I asked about follow-up appointments, she said they'd call me, but I could tell from her voice that they wouldn't. My stomach churned with more than just post-surgery nausea. I never got a call, so I tried calling the surgeon's office myself, but they kept saying he was unavailable. After a week of trying, I drove to the hospital for answers, but security stopped me at the entrance. They had my photo at the desk and said I was permanently barred from the premises. When I demanded to know why, they just said it was a medical decision and escorted me to my car. The surgical site was healing fine, but I needed the follow-up care to make sure everything was normal inside. I made an appointment with a different doctor across town, but when I got there, the receptionist looked at her computer and her face went white. She excused herself and came back with the doctor, who said they couldn't treat me and I needed to leave immediately. This happened at 4 different clinics. I called my insurance company to complain, and the representative put me on hold for 20 minutes. When she came back, she said my account had been flagged with some kind of code she'd never seen before. She couldn't tell me what it meant, but said no doctor in their network would be able to see me. My hands were shaking as I hung up, because I realized I'd been blacklisted from medical care. My friend, who worked as a nurse at a different hospital, tried to look up my records for me. She called me an hour later and said she couldn't talk about what she'd found, but I should consider leaving the country. When I pressed her for details, she said there was a note in my file that she'd never seen before in 15 years of nursing. She wouldn't say what it said, but told me never to contact her again. I hired a lawyer to get my medical records, but he called me after reviewing them and dropped me as a client, but not before suggesting I get my affairs in order. Though he wouldn't explain why, the fear in his voice made my skin crawl. I started feeling fine physically, but the psychological toll was destroying me. I couldn't sleep wondering what they'd seen inside me during that surgery. I kept checking my incisions, but they looked like normal healing wounds. 3 months passed, and I'd been turned away from every medical facility within 100 miles. Even veterinarians wouldn't see me. A dentist took one look at my chart and asked me to leave. I was completely cut off from any form of medical care, and nobody would tell me why. I found out that one of the surgical nurses had quit immediately after my operation and moved to another state. I tracked her down and called her, but when she heard my voice, she started crying. She said she couldn't